Okay, hi again. So there is another live demonstration video about the facial rejuvenation and improvement of the face with the filler and botulinum toxin. Our model today is a 50 years old lady with no medical condition, and she had a few times filler and also neurotoxin injection in the past. Today we're gonna mostly focusing on the upper face and forehead and temple rejuvenation. Although we're going to focus mostly on the upper face, but like any other clients, we're going to do a full face assessment. Uh, the first part of assessment and our measurement would be the vertical line, starting from the hairline to the base of the nose or the glabella region, from glabella to the base of the nose to the chin. These distances should be equal. If I do some measurement on my model today, this is almost 6 centimeter, almost equal, and almost 6 centimeter. So the length of the nose, from the nose to the chin, and the forehead is almost equal, which is very good, so we don't need to do any changes on these measurements. And then we're going to go to the horizontal lines. One of the distances very important for us is between the canthal, the medial cantuses, between the eyes. On her is around 4 centimeter. This distance should be almost the same of distance of the base of the nose, the most volume part of the lip, and also the chin. So we're going to do some measurement here again. Almost 4 centimeter. Base of the nose. It's a little bit less than 4. So we need maybe a little bit volume here. And the chin is a little bit maybe filler on the sides. It's a little bit less than 4 centimeter. The other measurement that we like to see, it's from the, again, the medial canthus of the eye to the angle or the arch of the eyebrows. So in her, it's about 5 centimeter. Almost 5 centimeter, almost equal. We might need a little bit lifting of the eyebrows in the medial side and also the lateral part. You will see a little bit volume loss in the upper orbit that we're going to try to fix it today with filler injection. We're going to look at the mid part of the forehead. If you look at the lateral side of the face, normally we like it very nice and concave here. We see a little bit hollowing in this area. So if we can give a little bit volume to this area, so it's be a nicer light reflex. Then we go to the side, again for a little bit lifting of the eyebrow and also having a nicer, smoother temple. It might give a little bit volume in this area, in the temple. And again for giving a little bit more lifting of the eyebrow, we might to inject some filler in this area today. Beside of that, as you can see, she has also some horizontal wrinkles that is mainly the target of the botulinum toxin that we're going to inject. If you want to do more treatment for her, I'm going to go to the other lines. One of the important lines that we always use it for our assessment is a line from the corner of the eye, goes all the way to the corner of the mouth. The other one from the mid-tragus, corner of the mouth. And the other line is from the corner of the lateral canthus, go all the way into the upper tragus. And if you make an oval shape here, this is the main area that you want to have the highest and the most volume of the cheeks. There's another important line. If you look at the orbital rim here, and find the mid part of that, and another line from the upper part of the ella of the nose goes to the upper part of the tragus, and then a vertical line where these two lines cross each other. This part should be the highest part of the cheek in female. In male, it's usually lower. So if you look at this side and that side, so I don't see very asymmetric, but we might be able to give a little bit volume to this area to have a nicer reflection of the light here. So whenever you want to inject filler in the forehead and temple, you should know the anatomy of the important structures like the vessels to decrease the risk of vascular occlusion or definitely retrograde embolization and blindness. So a few structures are very important here are the arteries. So one of the arteries that you have to know the surface anatomy is the supraorbital artery. Usually, if you want to find it, you can just try to touch the orbital rim, and if you can find a notch, this is where the supraorbital is sitting. But the better way is that ask the patient just to look at here, and where the medial limbus is, the medial part of the iris is. If you go up, in 100% of the patient, the supraorbital artery is there. It's a deep structure, comes from the bone. In the first 1 centimeter is very deep, and then it gets very superficial, go all the way and give branches here. After the 1 centimeter, it's going to be very superficial. Why is it important? When you're injecting in this area, you have to inject deep. You are not injecting superficial here because that's where the artery is. When you're injecting deep, yes, you might pass through the artery, you might have a little bruise or bleeding, but you're not going to have any vascular occlusion. For the supratrochlear artery, usually asking the patient to make a frown, or you can help the patient to make a frown, where the medial part of the frown line is where the supratrochlear artery is sitting. And again, in the first 1 centimeter is usually deep, and then it's going to get superficial, and it makes branches. And we know that these two arteries are the branches of internal carotid artery, not external. The other important artery is, you have the superficial temporal artery here, and give one of the branches here, the frontalis branch, which is also superficial, is not on the periosteum. This artery go all the way, pass through this artery, and give branches to the supratrochlear. So again, that's also important because it's a connection between internal and external carotid artery. So if you inject here, it can make embolization back, go to the retina, and makes it blindness. So these are structure you have to be aware of and try to avoid it. Another important structure here is the supraorbital nerve that usually goes to the lateral part, give deep branches here. If you go with a cannula or if you're even injecting with a needle, if you pass through the nerve, you will see that the patient will feel pain in the scalp area. It's going to be very painful. It's not going to be dangerous, it's not going to make any blindness or something, but it's going to be very painful because you're actually touching the nerve here. For the same reason, if you want to do any superior part of the orbital rejuvenation with a filler, if you are not an advanced injector, first of all, don't inject in this area. Two important arteries are here. One of the technique is that you just go from the side with a cannula. So when the cannula goes like that, there's no chance that you can get into the artery. So you're going to inject like this. Or if you want to inject with a needle, just be very careful that you are not going to the arteries. You can. Some doctors say they inject with a needle, but I myself, I like to do it with a cannula. I think it's safer. Just go from the side, go all the way, and then injecting. So because your cannula is like a horizontal and the arteries are vertical, so there's no chance that you inject into the arteries. Okay, so we're going to start with the forehead. So you're going to do a little bit filler injection here to have a nicer reflection and reflation. So I just, let this lines to stay there to see the anatomy of the arteries. As I mentioned, the artery is deep on the first 1 centimeter and then is superficial. So when we are injecting here, so we're going to go all the way, going to the on the bone and injecting slow, small amount. So we're going to do boluses here, and then we're going to spread. So what type of filler we are using? A filler that has a not low G prime and it's spreading easy. We are not using a high G prime with high viscosity filler because we are not looking for a big lifting. We just want something that's spread easily. So all injections here is going to be deep on the periosteum. If you're on periosteum, there is no chance that you're going to inject into the artery. Every time you have a bleeding, we're going to press. Okay. Again, we're going to do multiple injection, very small amount, and very slow. And we are looking for any signs of ischemia. If you see any blanching, if the patient has more than usual pain, then we're going to definitely stop and we start a treatment for that. Again, if you're injecting deep on the periosteum, that's very unlikely that we have any trouble here. Okay, for the temple, we're usually looking for the ridge here. This is the temporofrontal junction. So usually this ridge is thicker in the lower part. We're trying to find the ridge. This is the orbital rim, and this is the ridge. What we usually do, the sweet spot for us is about 1 centimeter above and 1 centimeter back. This is the area that is safe. There is no important artery there. So what I usually do, again, the injection here, we can do both superficial or deep. I usually do a deep. So we go in, touch the bone, put my finger behind, because I don't want the fluid goes that area, and then we slowly inject. And we are looking for lifting effect. The amount that we're injecting is 0.1 to 0.2 mils. And then I spread it. Sometimes we have to do 1 or 2 more. Deep injection above the periosteum. Okay, so for the superior orbital area rejuvenation, so as I mentioned, I'm going to use a cannula. So we're going to make a small hole. Sorry about that. Okay. Thank you. Okay, so we're going to try to go all the way to the front. You can use a 25 or 27 cannula here. The tip of the cannula is here. So we're going to inject very slowly, very small amount. Okay, again we're going to find a frontotemporal junction ridge, 1 centimeter above, 1 centimeter back. Just be sure there's no vein. She has a vein exactly here. So a little bit behind of that vein. I put our finger here. on the periosteum. Sometimes you can even feel the pulse of the frontal branch of the superficial temporal artery. The type of filler we're using for the temple is going to be a little bit higher viscosity and higher G prime than the one we use for the forehead. I can feel the pulse under my finger here. This is her artery under my finger. Okay, and the last part of the treatment for her would be the botulinum toxin. We can use Botox, Dysport, Xeomin. We are using Dysport today. So that's mainly for the active wrinkles. That she has the horizontal line in the forehead due to activity of the frontalis muscle. She has some wrinkles in the glabella due to depressor muscles. And also she has some goose-feet line that we're going to target that with Dysport or neurotoxin injections. Can you make a frown, please? Okay, so just relax, please. Relax it. So we're going to inject this port here. And the procerus muscle. Target the depressor supercilii, the medial side of the corrugator. Frowning thing. Okay, relax please. She doesn't have much movement in the lateral corrugator, so I won't do that part. Raise up your eyebrows, please. Okay. There's also some movement in the frontals, although it's not very strong. So we are not injecting the lower part of the frontals as it is a high risk of drooping of the eyebrow. So we're going to stay at least 2 centimeters above the orbital limit, even on her maybe even 3 centimeters above. She doesn't have very strong frontalis. We're injecting multiple injection. Try not to inject very deep this injection. As you touch the bone, it might make a little bit headache after the toxin injection. The injections are very small amount, like 1 or 2 units each of them. Multiple in the upper part of the forehead, not the lower part of the forehead. Okay. And the last part would be the goose feet. Can you make a big smile? Okay. You can see the pattern of her is that she has more activity in the lower part of the lateral orbicularis. There's some vessels. I'm going to put my finger here, about 1 centimeter lateral superficial injection. Fan shape. Can you close your eyes tight? Tight. Look at me. Yes. Relax. Again. So there's some movement when she's closing tight, the eyebrow goes down. So if you inject a little bit botulinum toxin under the eyebrow where the orbicularis is sitting, so she might get also more lifting. So I'm going to do a little bit injection. 2 units here. Make this muscle weaker on this side, and then the frontalis hopefully gets stronger and will lift up the eyebrow. Okay, so what we did for our model today, so we did some rejuvenation of the forehead, temple region. We did the eyebrow lifting with the filler and also rejuvenation of the superior part of the orbital region. We also did some botulinum toxin injection, which we are not going to see the result. And that's all we did for her.